Third body wear is a term used by orthopedic surgeons to describe particulate in a wound actually getting in the bearing surface, which is the ball and the cup part of a hip implant. In this case, there are two kinds of metal problems that Stryker patients have when the device fails. One is it creates tiny little ions, submicroscopic ions of metal debris that circulate in the patient's blood system. It actually gets in the tissues around the hip too. The second is that the device actually casts off metal particles, pieces, like shards of metal, but it's tiny. It's microscopic shards of metal. When the doctor does the revision surgery, you can only get so much of that out, and some of that remains behind. And despite the fact he takes the old device out and puts a new device in, there's still a ceramic head and a plastic cup that remains after that surgery, and these little pieces of metal get in that bearing surface. And it's like having sand in a beach bag. You just can't get it all out. And so the bearing surface won't last as long. And in the Stryker situation, it's even worse than third body wear concerns when DePuy SR failed, because the doctor, in order to get the Stryker device out, to get that nail that's down in the femur with the bone grown into it out, has to use a drill and or osteotomes that you run down the side of the device to disrupt the bone that's grown into it. You have to basically chisel it out or drill it out. And when you're doing that, you're creating more metal debris. You're creating even more metal in the wound, and the doctor can't get it all out. So one of my biggest fears for these Stryker patients is, even if their revision surgery goes well and they go through their rehab and they get strong again, that on a long-term basis, the metal that remains in their hip, both caused by the defective device and the surgery to get it out, is going to make the bearing surface of this device, the revision device, not last as long. So for young patients, that's really important, who are certainly looking at having to live with the revision device for 10, 15, 20, 30 years. Those devices aren't going to last as long. They're going to fail earlier. There are two things that I'm concerned about for Stryker patients, even when their revision surgery goes really, really well, and their rehabilitation goes well, and they return to function again, fairly reasonable function. On an ongoing long-term basis, I'm concerned that, number one, for the young folks, that because they have to live with the results of having had metal in their body and in their blood system, because they have to live with that for so long because they're young, they're at increased risk of developing all kinds of cancers as a result of being exposed to the heavy metals. And two, because of third body wear and the debris that's in the hip that's caused by both the device itself and how it fails, and because of the revision surgery and what it takes to get it out and the creation of more metal in the wound, that these devices are not going, the revision devices are not going to last as long. They're going to fail much sooner. And I'm really even concerned that that debris in the hip that's left when the hip is closed up after revision surgery might get in the bearing surface and actually cause deterioration of the polyethylene. And you might end up with poly disease, which is something that they had a problem with in first and second generation poly. This new highly cross-linked poly is supposed to eliminate the risk of that kind of wear, not third body wear, but wear causing poly disease. And I'm worried that these people might end up with poly disease. One of the most ironic things about the Stryker failure situation is that these patients not only may have to live with the consequences of metal poisoning, but they also, because of third body wear on a long-term basis, might end up having to deal with the consequences of polyethylene poisoning as well.